my name is Ella, and these are my group mates Teresa, Michaela, Helen, and Rakaya. In this presentation, we will be discussing about a current health concern that we found from global news, which is about polio. Poliovirus is a highly contagious viral infection that can cause paralysis and death. It is important for nurses and healthcare workers to know about polio as they play a key role in the prevention, early detection, and education about polio. They need to be able to understand the disease so that they can recognize symptoms. They also need to educate patients about the importance of hygiene and vaccinations to prevent and protect others.
Okay, so this slide is our peer-reviewed literature. So these are the following articles that will be referred to throughout the presentation. So first we have our global news article, which is Alberta Polio Survivors Fear Horrifying Virus Could Return by Quinn Oler. Then we have our first supporting article, which is Progress Toward Poliomyelitis Eradication Worldwide January 2021 to March 2023 by Scarlett E. Lee and a whole bunch of other authors. And finally, we have our second article, which is Do Polio and Smallpox Present a Threat? What Nurses Know Can Help Them Prepare by Lisa Drees.
The philosophical approach to which uses social justice. It is a nursing philosophy that based off fairness, equality, and human rights. It means making sure that everyone has the same access to opportunity, healthcare, and safety, regardless of their background or their situation. And in nursing, it guides us to advocate for those who are marginalized and to promote equal treatment and dignity for all the people. The first article by Quinn Orler used social justice approach by calling out public responsibility to maintain a high vaccination rate. Since there is no cure for polio, prevention through vaccination is very important. And in the article, survivors share how the disease changed their life through their disability, trauma, and lifelong struggles. And by telling their stories, they're encouraging others to take vaccination seriously so no one else can suffer the same way as they did. This affects social justice because survivors are using their voice to promote fairness and to protect the community, and their experiences remind readers that everyone deserves equal protection from a preventable disease. The second peer-reviewed article is made by Scarlett E. and et al. It reports that poliovirus still spread in countries like Afghanistan and Pakistan, and that vaccine-derived cases, meaning a virus that comes from a weakened vaccine strain and spread when not enough people are vaccinated, has been found in parts of Africa, the United States, the United Kingdom, and even Canada. It explained that low vaccination rate, weak health system, and ongoing conflict makes it difficult to stop the spread of virus. And the author says that a stronger global cooperation is needed to end the transmission and to make sure that children everywhere are protected from polio. This shows social justice because it calls for fairness in health protection and equal access to vaccine for all the countries. The last article is a nursing implication made by Trace. It discusses how stopping a disease like polio requires more than a vaccine. It also depends on factors like public education, political support, and outreach to children in remote, migrant, and conflict-affected areas. Nurses are described as advocates who educate communities, raise awareness, and ensure that no one is left behind. This connects to social justice because it highlights the nurses' role in promoting fairness and equality in healthcare. And the article also emphasized the nurse's duty to stand up for those who lack equal access to care and to ensure that everyone receives the same opportunity for protection and health education.
This news article creates a strong emotional impact through past marriage story and furnace trauma. It emphasizes the voice for those vulnerable groups. This humanizes the issue and makes the threat of polio feel real rather than theoretical. It delivers a clear and strong message and provides scientific way to protect those children, especially under 5 years old, like get vaccinations on time to prevent those suffering. However, from the news article said, the estimated polio vaccine coverage by 2 years of age dropped in past decades, about 85% in 2021 compared to 93% in 2017. His limited discussion by lacking of the reasons behind vaccination hesitation. Why people hesitate about get vaccination? Is there any lack of spread of education? Also, it's oversimplified solution by ignoring the real-world implementation challenges for those areas like Pakistan and Afghanistan. However, from CDC reports, it highlights social political barriers behind, such as security compromised districts, substantial movements of subpopulation at high risk. So that's the reason hundreds of thousands of people are unvaccinated.
Okay, so now we're going to be looking at voices that could be potentially be missing in this news article. So the first voice we realized that was missing is scientific knowledge. So the global news article doesn't explain how the poliovirus spreads. So poliovirus can basically be spread through water, which is briefly talked about in the article. As it says, polio is mainly spread from person to person, often through contaminated water or contact with fecal matter. The report basically can emphasize on this by saying environmental surveillance testing sewage samples helps scientists detect poliovirus early and how it spreads in communities. So basically, by knowing the importance of environmental surveillance would be good for readers, as it puts an importance on monitoring contaminated areas like water in order to detect potential polio outbreaks in Canada and globally. And then we have our expert voices. So the article does shine a bit of light on the World Health Organization and their contributions to preventing polio, which was the 1988 eradication. It doesn't include like their expert perspectives of like WHO or PAC officials who could better explain why things are being put into place to prevent polio outbreaks. So the CDC report basically emphasizes that polio can still resurface in places where it has been previously eliminated if the vaccination rates drops. And it also highlights the need to continue mass immunization and close surveillance to fully stop the global threat of perilytic polio in children. So by being able to hear what public agencies have to say about how to fully stop the global threat of polio, it shows that these agencies have done their research and are you finding the most effective ways, which is through vaccines, in order to protect other people and yourself if potentially another polio outbreak could happen.
So for cultural considerations, the article Progress Toward Poliomyelitis Eradication Worldwide January 2021, March 2023 explains that global cases of wild poliovirus have decreased by over 99% since 1988. However, Afghanistan and Pakistan remain the only countries where transmission of the virus has never been interrupted. In 2021, there were only 5 cases of the virus reported in Pakistan and Afghanistan, but since then, cases have rebounded. In 2022, Pakistan reported 20 cases and Afghanistan reported 2. Both nations face security challenges, political instability, and cultural resistance to vaccination. Populations in rural or conflict-affected regions are often marginalized, facing barriers to healthcare and education. In contrast, countries with strong health systems like Canada are culturally privileged because they benefit from stable institutions and reliable medical services. And as we can see from this diagram, between January 2021 and March 2023, wild poliovirus type 1 cases in Afghanistan and Pakistan showed a clear overall decline compared to earlier years. Both countries had high case numbers in 2020, but cases dropped sharply in 2021. Pakistan, however, experienced a brief resurgence in 2022, with several new cases reported between April and July before numbers fell again in early 2023. Polio challenges. So as stated in Global News 2025, polio was eradicated in Canada in 1994. And according to Global News, Alberta polio survivors fear a horrifying comeback as coverage for young children drops from 93% in 2017 to 85% in 2021. So how can we improve cultural sensitivity and inclusion? Health organizations should work closely with religious and community leaders to build trust, employ and empower female health workers in conservative regions, coordinate across borders to reach mobile populations, and in wealthier countries, combat misinformation and rebuild public trust in vaccines and science.
The lived experience of the polio survivors remind nurses why patient education and continued vigilance are crucial. So what are the possible nursing implications? According to JACE 2023, the nursing implications are: first is staying informed about emerging and re-emerging diseases. Nurses need to maintain knowledge about the symptoms, signs, and modes of transmissions of polio. Some of the signs and symptoms include fatigue, fever, muscle weakness, extreme sensitivity to touch, paralysis, nausea, sore throat, and many more. Next is maintaining infection and prevention control skills. It is important to know isolation procedures, PPE use, and outbreak containment approach. Nurses should be ready to respond when a case comes up. And next, we have promoting vaccination and public education. It is critical that nurses educate patients and communities about vaccine safety and effectiveness. Addressing vaccine hesitancy and misinformation is a recurring implication. Next, we have ethical responsibility and advocacy. Nurses have a professional and ethical duty to protect public health by staying up to date on immunizations and educating others. And lastly, we have supporting public health surveillance efforts. Nurses play a role in tracking immunization gaps, unusual symptoms, and alerting public health authorities when indicated.